my name is Vanessa. I'm a respiratory care student from Malcolm X College. For today's video, we were given an example of a patient setting that we're going to use to calculate the raw and their static compliance. But before you watch this video, make sure to take a look at the previous video so I can fully explain what raw and static compliance is. So, patient settings that we were given today is a peak inspiratory pressure of 35 centimeters of water pressure, a plateau pressure of 25, a tidal volume of 550 mLs, and a PEEP of 5. So first we're going to go ahead and calculate the raw. And remember, raw is the airway resistance, and we get this by subtracting the peak inspiratory pressure minus the plateau pressure. In this case, 35 minus 25, and it gives us 10 centimeters of water. So remember that the normal range for a patient on a ventilator is 5 to 10 centimeters of water, and based on our calculations, we got 10 centimeters of water, which falls within that normal range, so we can conclude that airway resistance in the patient is not an issue at this time. Next, we have our static compliance, and remember that static compliance is a reflection of the elastic resistance of the lung and the chest wall. And to get that calculation, we use the patient's corrected tidal volume over their plateau pressure minus their PEEP. In this case, it's 550 mLs over 25 minus 5 centimeters of water. And it gives us an answer of 27.5 milliliters per centimeter of water. So this means that for every 1 centimeter of water pressure applied to the patient's airways, I can distend the patient's lungs with 27.5 milliliters of volume. And remember that the normal range of static compliance is 40 to 60 mLs per centimeter of water. So we can conclude that the patient's compliance is low, possibly meaning a restrictive disease. An example of this would be a patient with pulmonary fibrosis, that it impairs their lungs to properly distend due to the stiffness of the lung tissue.